Hi there everyone, this is Adrien, the exercise specialist from the Leduc, Beaumont, Devon Primary Care Network. I hope you all are doing well today. For today's video, I thought I'd show you guys a few more kind of trigger point therapy, deep tissue release type of movements that you can do for kind of your entire hip complex and your low back complex. So where these can kind of be beneficial is for someone that's dealing with things like really tight hip muscles or really weak hip muscles, which we do to a myriad of different things. If you get hip or low back pain that's kind of related and could be one of the deep muscles in there, things like that. The hip complex is really a complex system within the body. There's tons of little muscles going in every direction that you can think of in there. From your front of your hip to the back of your hip to your low back to your abdominal wall, all of those places and more. And there's plenty of little nerves and blood vessels that kind of intertwine between the muscles and things like that. So I wouldn't say it's uncommon, but it's a somewhat common occurrence for someone that has some kind of a hip injury or something like that, or a tight muscle or something like that, where they pinch off a nerve that can reduce strength or increase the tonicity of the muscle, so the muscle is just a little bit more tense than it can, or it can get more tight. Because having a tensed muscle and a tight muscle, so a tight muscle and a muscle with extra tone, are two different things. People oftentimes confuse them, but having a muscle with extra tone to it, so the muscle is in a partially neurologically active contracted state, as opposed to a tight muscle, are two different things, though they can feel similar if you don't know what you're looking for. That's a common occurrence with a lot of people's hamstrings. Everyone thinks they have tight hamstrings, but a surprising number of those people's hamstrings just have a little bit of increased tonicity to them. And if you can actually work on down-regulating the tonicity, you can actually really loosen up people's hamstrings. So yes, I'll be showing a few kind of trigger point therapy, deep tissue movements for your hip and your low back. Very quickly here, I'll just show you guys how to do them on one side. I would always recommend doing it on both sides to keep things even, but if you have one side that's a significantly disproportionately weak side to the other side, then obviously focus on that side until they become closer to normal. So doing this kind of work can often help to make a nerve fire a little bit less intensely, or if you have muscle that is kind of squishing on a nerve, you could hopefully loosen up that muscle a little bit so the nerve can fire a little more freely, so on and so forth. A lot of these are fairly uncomfortable. They can be quite painful. I'm not looking for a 10 out of 10 pain, but they can be more painful than people realize if you're not used to doing deep tissue work. So something to keep in mind. This video is not to be used to diagnose or to treat any specific type of injury. It's simply an example of exercises that are often done for people that are experiencing things like hip and low back weakness and tightness, as Coach Luna comes to join me. Hi Luna. So yeah, I will show you guys the exercises, and I hope you guys find them helpful. Feel free to try them out if you think that they may be beneficial for you. But as always, if you're new to physical activity, if you return to physical activity from a long layoff, or if you have a medical condition that might make doing physical activity difficult, always consult with your physician prior to beginning any new exercise program. Thank you. So the two main tools for today, as usual, are the foam roller and the lacrosse ball. So this is obviously pretty much the easiest version over to the second hardest version. The hardest version being a golf ball, but I rarely would ever recommend, if ever, realistically never use a golf ball. If you use a golf ball, you're a sadist. So a lacrosse ball is about as hard as I would ever recommend. People sometimes use a tennis ball or a hockey ball because it's a little less intensive as this. The softer the ball, obviously, the less it'll actually push in. So just to briefly kind of explain kind of how we do this. Let's say this is the length of a muscle. Let's say this is my bicep muscle. So my shoulder's up here, my elbow it isn't here. So the muscle fibers run this way, right? They run top to bottom, right? They run from the origin to the insertion. That's how muscles work. So lots of different ways to do deep tissue work, either on the muscle or on a nerve or a plexus of nerve. You can run along the muscle, so we go up and down. You can go cross-sectionally, so across, or you can go circles. So when I'm saying those terms, that's what that means. Along the muscle, cross-sectional, or in circles. It's really that simple. And those are the 3 different movements that we use for this kind of thing. So the first one that I will show you guys here, I will be targeting the very front of my hip here. So if you feel on your hip bones, you find the bones on each side, and you go down, and you can feel where the bones start to, you know, dip inside. So right there, we are at what is called your what is called your ASIC. So it's your anterior sacral iliac crest. So anterior front, sacrum, iliac. So this is your iliac and the crest. So it's your ASIC. So we want to find that spot. We're going to press the ball down. So once again, I'll show you this here, right there. You're going to press the ball down with both hands, push in, relax a bit, and do some circles. So this is the least intensive way to do it. You can go side to side, front to back, so on and so forth. The more intensive version is to actually lay down on the ground with the ball on that part of your hip. So I will come to the hard surface here on my deadlift platform. I will lay down. I'll put the ball on that part of my hip, and then you gently roll on top of it. So now my body weight is what is, you know, digging into to the lacrosse ball here. So this is far more intensive. And you just slowly, like right now I'm going side to side. I can do that 5 times, front to back. And then just really small circles, just rolling on the ball. The more of your body weight you can get on the ball, obviously the more intense it will be. And it should be a fairly intensive feeling thing. So that's for the front of the hip. Moving on to the side of the hip, there are 2 versions. There are 2 versions that I would like people to give a try. So you have this muscle on the outside of your hip here, right on the side. You can feel it here, right here. So this is one of your hip abductor muscles. So it's a muscle that abducts your leg away from your body. Abduction, like an alien abduction. An alien is abducting your leg away from your body. So AB abduction. So you can take the ball, put it right on that muscle there, right there. And you can do the same thing. You can roll in, or you can do the same thing where you go onto the wall and you do it. And now you're leaning against the wall, or the most intensive version obviously is you lay it down on your side, put the ball there, and you're just going to gently roll with your body weight forwards and backwards on the ball. And this one is a pretty intense one. This works those abduction muscles. This can, you know, trigger kind of the top of your IT band and all of those relevant muscles. All right. Coach Luna is coming because she agrees and because she wants the lacrosse ball. For some reason, it's her favorite ball, and I think that's because it's the one ball that I don't let her have. I'm sorry, Coach Luna. All right, so the next one for your hip that I find people really need is right on the side of your glute here. So if you notice on the side of your glute, there's a bit of a window in here where there isn't as much musculature and there's kind of an indent where it goes in. So right in there is a great way to actually start to facilitate some pressure on the nerves and the relevant small musculature in the area. So we can push right down in there and do circles. Back and forth. Or obviously the most intense version, and this is one of the most common kind of lacrosse ball movements you see people do, is you put the ball on the area there. So you find that spot right in that window of your glute muscle. You cross your other leg over top. It helps to stretch it out, open it up a bit, and then from here you just dig it in there. And I will tell you, this one, for most people, including myself, is not very pleasant. You can honestly even just sit there for a little bit and just let the weight of your body just sink into it, right? So what I'm doing here is I'm trying to focus on the muscles in the area, and I'm trying to really let them relax. I try and think about letting the muscles melt around the lacrosse ball, right, Coach Luna? So you want the lacrosse ball to almost melt, or sorry, you want your body to try and melt around the lacrosse ball. Just let your body get deeper and deeper into there. And you do that, and after you do that for a while, the pain will dissipate. It will start to dissipate. At first, it was about a 7 out of 10 pain for me. Now it's about a 4, if I was to continue doing this, it'd probably eventually get down to a 2 or so. It'll never actually go away, or realistically won't do it for a long time maybe, but that's probably too long, right, Coach Luna? But that's another fantastic one right there. That's probably, in my opinion, the most important of all of the hip complex trigger points to work on with a lacrosse ball. The final one I'm going to show you for this video is actually right on the back, on the top of the glute, as we get to kind of your you know, glute medius, glute minimus area ish. So for this one, I'll just show you over here. So from here, we're from the top of the glute, and we can just bring it down to where the muscle just begins to start. We use side to side circles, and then once again, you lay down. You find that spot right at the top of the glute, and same thing. I'm just gonna let the weight of my body melt around the ball. See, right now this is about a 7 out of 10 pain. This is not very pleasant, but as I just, you know, focus and just really trying to relax those muscles, as they begin to relax, they will release more, and you'll be able to sink deeper into it with a little less pain. See, I'm already down to about a 4 out of 10. So this is releasing quite quickly, which is great. The longer it takes to release, obviously that means, you know, things are a little bit more tight or have increased or increased tonicity, and those are things that we generally, you know, want to be a little bit wary of. So those are the main 4 kind of trigger point deep tissue things that I recommend doing with a lacrosse ball. You can do almost all of this. Like, you can do all of the same ones with a foam roller, just to start and to get, you know, used to it. So you can just roll side to side on it, so on and so forth. All the same areas you can do with this. So it's just a little bit less intensive overall. The next ways to kind of make it more intensive, which I won't really go into detail in this video, is doing some actual passive range of motion stuff. So we actually press the ball into your hip, and then we get you moving your leg out side to side and things like that, and or pushing it into your hip against the wall, and you can move your leg forward to backwards. So, but really slowly. So you're starting to move the muscle around the ball. It really helps to dig in there, and, you know, potentially loosen up the muscles, or even maybe, you know, reduce the actual neural firing a little bit, help things relax a bit. Or if some things are underfiring, it might even help to upregulate it a bit. A lot of the research on you know, trigger point therapy and things like that isn't 100% conclusive by any means. It'll by no means solve and fix every condition in the world involving, you know, your nerves or your muscles, and it won't fix every tight muscle or underperforming nerve pathway or anything like that. So it's by no means a miracle, but it is just another tool in the toolbox for recovery and for, you know, working on progression. It's just one of the many things that, you know, we can look at to try and help people as they recover. So I hope you guys found that helpful. If you have any questions, feel free to post them down below. And yeah, I hope you guys once again really enjoyed that. It's a fun way to actually train once you get used to it. It does loosen things up. I know, as of a couple weeks ago, I had a pretty you know tight back one side. I'm back to normal. You know, I had no issues. I'm feeling good, and this was a pretty important adjunct therapy for me. Not a primary therapy, but an adjunct therapy, which is, in my opinion, what it's best used for. So yeah, please subscribe to the YouTube channel and like the video. My name is Adrien. I'm the exercise specialist at the Leduc Beaumont Devon Primary Care Network. Thank you so much, and have a great day.